Hello, I'm Sally Pipes, President of Pacific Research Institute and the author of a new book, The Truth About Obamacare, published by Regnery Publishing. President Obama, in pushing for the passage of the Patient Protection and Affordable Care Act, promised the American people two things. One was universal coverage, and the second was bending the cost curve down. When you analyze these two issues, universal coverage, the Congressional Budget Office has said that by 2019, 23 million Americans will still be uninsured, so we have not reached universal coverage. The second point about bending the cost curve down, the Congressional Budget Office countered what the President had said over and over again, that the average premium for the average family would decline by $2,500. The CBO said it would increase by $2,100. The President finally admitted a couple of months ago that the cost would increase. Everyone in America wants affordable, accessible, quality care, and that is the goal for all of us. There are two competing visions for reforming our healthcare system. One which relies on increasing the role of government in our healthcare system. That is what President Obama had as his vision. He ultimately wants Medicare for all. In America today, 50% of healthcare is already in the hands of government through Medicare, Medicaid, the State Children's Health Insurance Plan, and the Veterans Administration Plan. The other vision involves empowering doctors and patients, putting people back in charge of their healthcare. This is the vision that I support. And what we need to do is to change the federal tax code. The federal government got us into this mess during World War II when wage and price controls were in effect. The government gave companies the ability to write off the cost of what they spend for their employees on health care. And so if you're an employee, you get your health care. Maybe you pay a small amount for a copay or the premium, but basically your health care coverage is provided tax-free by your employer. If you quit your job or you lose your job, you go out into the individual market and you have to buy your health insurance with after-tax dollars. So I would like to see that playing field leveled so that individuals could buy their health insurance with pre-tax dollars as well. We could then start building a strong individual market in health care. I think we need to encourage the states to reduce costly mandates. There are about 2,100 mandates on insurance companies across this country, about 50 in each state, anything from alcohol rehabilitation to hair prostheses to in vitro fertilization. These mandates add 20 to 50% to the cost of a premium. People should be able to buy the type of insurance plan that suits their needs, not be forced to buy a plan that covers things that they don't want. We also need to encourage the states to do tort reform, medical malpractice reform. Doctors practice defensive medicine in this country because they are afraid of being sued. The cost of this defensive medicine, according to PricewaterhouseCoopers, is about $212 billion a year. Texas did medical malpractice reform in 2003. They've seen a great influx of doctors into the state of Texas. Medical malpractice insurance rates have gone down. We need to cap non-economic damages and cap punitive damages, and this will reduce the cost of medicine and the cost in particular of doctors doing defensive medicine. I think one of the things that could be done by the federal government is that they could have beefed up the high-risk pools in those states so that those people who are chronically ill without health insurance for a period of 2 years or more could get insurance in these pools. And that would probably cost about $30 to $50 billion, but it would be an interim step until we get an individual health insurance market actually operating. And last, I believe that people should be able to buy insurance across state lines, because if you're a young man living in New York, it's the most expensive insurance in the country. You might want to buy an insurance plan that fits your needs, that's from Arizona or Idaho. At the moment, you can't do that, and I think it's an important step to leading to affordable, accessible, quality care for all Americans. We do want universal coverage. Universal choice is the key to universal coverage. The main question is, who do you want to be in charge of your health care? An HMO bureaucrat, a government bureaucrat, or do you yourself want to be in charge of your health care? Thank you.